Today I'm going to debunk a bombshell that could be harming your health without you realizing it. You know those absolute truths about diabetes that everyone repeats? Well, most of them are completely false. I've treated over 2,000 patients with diabetes and prediabetes in my practice, and one thing I can guarantee: misinformation kills more than blood sugar. I'm going to reveal the 7 biggest myths that cause millions of people to suffer unnecessarily every day. And the worst part, the 5th myth is so dangerous that it's destroying the recovery chances of 90% of my patients when they first come to my office. In the next few minutes, I'll show you exactly what science really says about drinking alcohol, eating sweets, fruits, and following diets when you have diabetes or prediabetes. Get ready for some surprises that might completely change your view of this disease. Myth number 1: diabetes is caused only by eating too much sugar. One of the most common myths I hear in my office is, "Doctor, I got diabetes because I loved sweets." This is a dangerous oversimplification that needs to be debunked. Type 2 diabetes, the most common, representing about 90 to 95% of cases, is a complex condition influenced by several factors. Although excessive sugar consumption can contribute, it alone does not cause diabetes. The truth is that the development of type 2 diabetes involves a genetic predisposition. Studies with identical twins show that if one has type 2 diabetes, the other has a 70 to 90% chance of developing it too. Insulin resistance. Your body produces insulin, but the cells don't respond properly to it. This happens mainly due to visceral fat accumulation, that deep fat around organs, not necessarily the one you see. A chronic inflammation. Recent research from Harvard University shows that low-grade inflammation impairs insulin signaling. A sedentary lifestyle. A study published in the Journal of Applied Physiology showed that just 2 weeks without physical activity can reduce insulin sensitivity by 25%. A real example from my practice: Sandra, 53, skinny, never ate sweets, and still developed type 2 diabetes. Why? Strong genetics, her parents and grandparents had it, high chronic stress, high cortisol interferes with insulin, and zero physical activity. On the other hand, I have patients who consume desserts regularly and maintain perfect glycemic levels because they take care of other factors. They exercise regularly, control stress, and have good genetics. So yes, sugar matters, but it's just one piece of the puzzle. Treating diabetes as the fault of those who eat sweets is not only scientifically incorrect, but also stigmatizes people who are already dealing with a challenging condition. Myth number 2: diabetics cannot eat fruit. This is one of the most persistent and harmful myths I encounter in my clinical practice. Many patients come to the office saying, "Doctor, I've eliminated all fruits from my diet because I have diabetes." Let's look at the facts. Fruits contain fructose, a type of sugar, but they come packed with fiber, antioxidants, vitamins, and essential minerals that are beneficial for people with diabetes. A study published in the British Medical Journal followed more than 500,000 people for 7 years and found that regular consumption of fresh fruits was associated with a significantly lower risk of developing type 2 diabetes and fewer complications for those who already had the disease. The fibers present in fruits are crucial because they slow down sugar absorption in the blood, feed healthy gut microbiota, increase satiety, helping with weight control. The secret is in how to consume fruits. 1. Choose fruits with lower glycemic index. Apples, pears, oranges, strawberries, and berries generally have less impact on blood glucose. 2. Combine with proteins or good fats. An apple with a spoonful of natural peanut butter causes a much lower glycemic spike than the fruit alone. 3. Portion sizes. 1 serving of fruit, approximately the size of your palm, distributed throughout the day is better than several fruits at once. 4. Prefer whole fruit to juice. Even natural juices without added sugar eliminate fiber and concentrate sugars. I had a patient, Helena, 68, diabetic for 12 years, who eliminated all fruits from her diet out of fear. The result: chronic constipation, nutritional deficiencies, and, ironically, worse glycemic control. When we strategically reintroduced fruits, her HbA1c, glycated hemoglobin, improved from 7.8% to 6.9% in 3 months. The science is clear. Fruits are not villains for diabetics when consumed properly. In fact, eliminating them can deprive you of protective compounds that help fight the very complications of diabetes. Myth number 3, diabetics can never drink alcohol again. Let's talk about a topic that many doctors avoid discussing honestly: alcohol and diabetes. The truth. It's complicated, but it's not an absolute no, as many think. First, studies published in the Annals of Internal Medicine and Diabetes Care show that moderate alcohol consumption, mainly red wine, may be associated with better insulin sensitivity and lower cardiovascular risk, a common complication of diabetes. On the other hand, alcohol affects metabolism in ways that diabetics need to understand. 1. Late hypoglycemia. Alcohol can block glucose production by the liver for up to 24 hours after consumption, increasing the risk of dangerous hypoglycemia, especially if you take insulin or certain medications. 2. Invisible calories. A martini has more calories than a teaspoon of sugar, and many mixed drinks are loaded with sugars. 3. Affects judgment. Can lead to poor food choices or forgetting medications. Remember my patient Ricardo, a 52-year-old executive with type 2 diabetes, who almost had an emergency after a corporate party. He took his medication, had several drinks, and didn't eat properly. At 3 a.m., his wife found him disoriented with a blood glucose of 42 milligrams per deciliter, dangerously low. If you have diabetes and want to consume alcohol occasionally, follow these evidence-based guidelines. Limit yourself. Maximum 1 drink daily for women and 2 for men, where 1 drink equals 5 ounces of wine, 12 ounces of beer, or 1.5 ounces of spirits. Never drink on an empty stomach. Always combine with foods containing complex carbohydrates and proteins. Hydrate. Alternate with water, 1 glass of water for each alcoholic drink. Monitor more frequently. Check your blood glucose before, during, and up to 24 hours after. Identify yourself. Have something that indicates you have diabetes in case of emergency. Avoid sugary drinks. Prefer dry wine, spirits with water, or diet tonic. Talk honestly with your doctor. Each case is unique, and your doctor needs to know your real habits to adjust your treatment plan. The key is moderation and strategy, not total prohibition that leads many to lie to their doctors or feel unnecessarily deprived of important social moments. Hey, if you're enjoying this information that can literally save lives, don't forget to leave your like and subscribe to the channel. Share in the comments which of these myths you believed until today. I'll read and respond personally. Now, let's move on to the next myth that causes a lot of confusion. Myth number 4, there is a universal diabetic diet. One of the most harmful mistakes I see in medicine is the prescription of standardized diabetic diets, as if a single meal plan worked for everyone. Modern science shows that this is completely false. Research from the Weizmann Institute of Science has demonstrated that different people can have completely opposite glycemic responses to the same foods. In an impressive example from the study, one participant had glucose spikes when eating bananas but not when eating cookies, while another participant showed exactly the opposite pattern. Why does this happen? Several individual factors influence how your body processes carbohydrates. A unique gut microbiome. Trillions of bacteria in your gut influence metabolism, and your bacterial profile is as unique as your fingerprint. Genetics. Variations in at least 38 genes have been identified as influencing glucose metabolism. A lifestyle. Sleep, stress, and physical activity significantly alter how your body processes food. A meal timing. The same carbohydrate consumed in the morning can have a different effect at night. I'll share a real case. Carlos and Paulo, both with prediabetes, followed the same traditional diabetic diet. Carlos improved his markers in 3 months, while Paulo got worse. When we personalized the approach based on their individual data, Paulo finally started to improve. The truly effective approach is personalized medicine. Instead of focusing on generic diets, focus on 1. Self-monitoring. Use a continuous glucose monitor, CGM, or test regularly after different meals to identify your specific triggers. 2. Try different eating patterns. Some people respond better to low-carb, others to Mediterranean diet, others to plant-based. There is no universal answer. 3. Consider the total context. How you combine foods matters as much as which foods you consume. 4. Consistency and timing. Maintaining regular meal times can be more important for some diabetics than the exact content of the plate. This is an area where medicine is evolving rapidly. Generic meal plans are being replaced by precision approaches that respect your biological individuality. Myth number 5. If I don't take insulin, my diabetes isn't serious. This is possibly the most dangerous myth, and I see it destroying lives in my office. Many patients relax thinking, I only take pills, so my diabetes is mild. This false sense of security is extremely risky. Here's the scientific truth. Diabetes is progressive by nature, regardless of the treatment you currently use. Long-term studies, such as the UK Prospective Diabetes Study, demonstrate that pancreatic beta cell function, which produces insulin, tends to gradually deteriorate even with treatment. Not using insulin does not mean your diabetes is mild. It just means that 1. Your beta cells still produce enough insulin at this moment. 2. Your level of insulin resistance can still be managed by other methods. But here's the problem. Damage from elevated glucose levels happens silently, even when you feel fine. Elevated glycated hemoglobin, HbA1c greater than 7%, is associated with 35% increased risk of retinopathy, vision problems, a 20% increased risk of nephropathy, kidney problems, 40% increased risk of neuropathy, nerve damage. Even modest and temporary elevations in glucose cause vascular inflammation and oxidative stress that, over time, damage your organs. A devastating example from my office. John, 57, diagnosed with type 2 diabetes 8 years ago, was taking only metformin and thought everything was under control because he didn't need insulin. He avoided regular consultations and rarely checked his blood glucose. When he finally returned to the office with blurred vision, we discovered advanced retinopathy, peripheral neuropathy, and compromised kidney function, complications that could have been avoided with proper monitoring. What really determines the severity of your diabetes is a glycemic control, glycated hemoglobin, postprandial spikes, variability, a duration of exposure to elevated glucose levels, a presence of other risk factors, hypertension, dyslipidemia, etc., a development of microvascular or macrovascular complications. Not being insulin dependent is not a license to relax. In fact, this is exactly the time to be more vigilant, as you have the opportunity to prevent progression through irregular monitoring and treatment adjustments, consistent physical activity, a personalized nutrition, a control of other risk factors, a proper use of prescribed medication. The real goal is not to avoid insulin, it's to preserve your health and quality of life in the long term. Myth number 6. Type 2 diabetes is irreversible. This myth is particularly harmful because it robs millions of people of hope and motivation. Modern science has repeatedly demonstrated that for many people, not all, but many, type 2 diabetes can be reversed or at least put into remission. Let's clarify what reversal means: achieving normal glucose levels without medication for at least 3 months. It's not a permanent cure, as the predisposition may remain, but it's a state where the disease is not active. Rigorous studies prove this possibility. At the Direct Diabetes Remission clinical trial study showed that 46% of participants with recent type 2 diabetes achieved remission after an intensive weight loss intervention. In research from Newcastle University, patients who lost significant weight, about 15 kilograms on average, normalized beta cell function and insulin sensitivity. A study by Roy Taylor showed that even people with long-standing diabetes, more than 8 years, could achieve remission if they achieved sufficient visceral fat loss. The most important factor seems to be the reduction of fat in the liver and pancreas, not just weight on the scale. This explains why some thin people with type 2 diabetes can also achieve remission with the right approaches. Maria, my 62-year-old patient, had type 2 diabetes for 9 years and used 4 different medications. After following a personalized protocol that included specific dietary changes, strength training, and stress management for 11 months, she lost 13 kilograms, mostly visceral fat, and today maintains an HbA1c of 5.4% without medication for more than 2 years. Approaches that have shown the most consistent results include 1. Low-energy dietary interventions. Medically supervised 8001000 calorie protocols for a limited period. 2. Bariatric surgery, particularly effective for diabetes associated with severe obesity, with remission rates of up to 80% in some studies. 3. Low-carbohydrate diets, dramatically reducing metabolic stress on the pancreas. 4. Intermittent fasting, protocols such as 16:8 or 5:2 that improve insulin sensitivity. 5. Intensive exercise, particularly HIIT and resistance training, which dramatically improve glucose metabolism. It's crucial to understand that the window of opportunity for reversal is greater in the first years after diagnosis, although there are success stories even with long-duration diabetes. This isn't a miracle cure. It's solid science about how our metabolism can recover when we give the body the right conditions. The key is immediate action, a personalized approach, and long-term commitment. Myth number 7. Prediabetes isn't serious. This last myth is possibly the most devastating because it affects hundreds of millions of people who could avoid full diabetes, but don't take their prediabetes diagnosis seriously. Let's look at the scientific facts. Prediabetes, fasting glucose between 100 to 125 mg/dl or HbA1c between 5.7 to 6.4%, is not just a little sugar in the blood. It's a pathological state with 15 to 30% risk of progression to type 2 diabetes within 5 years if nothing is done. It already shows 50% of the beta cell dysfunction seen in full type 2 diabetes. It significantly increases the risk of cardiovascular diseases, neuropathy, and retinopathy. It is associated with accelerated cognitive decline and even early dementia. In other words, the damage has already begun, even if you don't have noticeable symptoms. In my office, Robert, 48, came for a routine checkup and we found a fasting glucose of 118 milligrams per deciliter. His previous doctor had just said, "Let's keep an eye on it," without specific intervention. When we did more detailed tests, we already found early signs of peripheral neuropathy and carotid thickening, damage that started long before the formal diagnosis of diabetes. The good news: prediabetes is the stage where interventions are most effective. The famous Diabetes Prevention Program study showed a 58% reduction in the risk of developing type 2 diabetes with moderate lifestyle changes. What really works to reverse prediabetes? 1. Modest weight loss. Just 5 to 7% of body weight, for example, 8 to 11 pounds for someone weighing 175 pounds, can normalize glucose levels. 2. Regular physical activity. 150 minutes per week of moderate activity. Doesn't need to be intense, just consistent. 3. Reduction of refined carbohydrates. Particularly important are high glycemic index foods and sugary drinks. 4. Sleep priority. Sleeping less than 6 hours per night significantly increases insulin resistance. 5. Stress management. Chronically elevated cortisol antagonizes insulin action. 6. Specific supplements. In some cases, nutrients such as chromium, magnesium, vitamin D, and berberine have shown benefits, always with medical supervision. Prediabetes is not a sentence. It's a warning that, if taken seriously, can lead to a longer and healthier life. Conclusion: truth above myths. We've reached the end of our journey debunking the 7 biggest myths about diabetes and prediabetes. Remember that accurate information is as important as any medication in treating these conditions. To recap: 1. Diabetes is not caused only by sugar. 2. Fruits can and should be part of a diabetic's diet. 3. Alcohol is not completely forbidden, but requires strategy. 4. There is no universal diabetic diet. 5. Not using insulin doesn't mean mild diabetes. 6. Type 2 diabetes can be reversible for many people. 7. Prediabetes is already a serious problem that requires action. In my practice, I see daily how the correct understanding of these realities transforms lives. Patients regain not only metabolic control but also their quality of life and future perspective. If you know someone with diabetes or prediabetes, share this video. Correct information can literally save lives. And don't forget to leave in the comments which of these myths surprised you the most. I'm looking forward to talking with you. Subscribe to the channel for more science-based content that can transform your health. This is Dr. Mike, and remember, knowledge is the best medicine. Until the next video.